Think about your last international trip, or your child's school bathroom, or the hiking trail you walk on every weekend. One of those places might have just silently exposed you to something that could alter your health for months. It's a parasite. Not the kind spread through contaminated food, which most people watch for. This one travels through human waste. What's shocking isn't that it exists. It's that millions of people carry it without realizing, spreading it to family members, coworkers, and communities around them every single day. My name is Dr. William Parker. I've spent 18 years in infectious disease, and I'm going to walk you through exactly what this parasite is, why conventional hand washing doesn't actually protect you, and the 3 habits that reduce your risk by over 80% according to the WHO. If you're finding this useful, subscribe now. Now let's get into it. Here's what most people don't know about parasite infections. Official case counts severely understate the actual numbers. The WHO estimates over 1.5 billion people worldwide are infected with soil-transmitted parasites right now. That's 1 in 5 people on Earth. Yet in the United States, we've created this false sense of security because we don't see those numbers reflected locally. Why? Because many people recover from infection without ever seeking medical care. Without testing, there's no official case count. So the real number is probably 5 to 10 times higher than what governments report. This matters to you personally because it means your actual risk is higher than local statistics suggest. Parasites travel with people, they move through produce supply chains, they spread through shared bathrooms at home. The practical takeaway: don't assume you're safe just because your state shows low numbers. Practice specific precautions regardless of what the official map shows. To understand why conventional hand washing fails, picture what you're actually dealing with at the microscopic level. A parasite egg, we're talking about hookworms, roundworms, and whipworms, resembles a tiny armored capsule designed by evolution to survive harsh conditions outside a host. Here's the critical part. These eggs are sticky. They adhere to skin and surfaces. Ordinary hand washing, the kind most people actually do for 5 to 6 seconds, removes maybe 60% of eggs, but 40% remain. That person touches a doorknob, eggs transfer. The next person touches that handle, then eats food. Infection occurs. What actually works? A 20-second wash with plain soap under running water removes approximately 95% of parasite eggs. That small difference in time from 6 seconds to 20 seconds creates massive differences in transmission risk. Alcohol-based sanitizers? Essentially useless. Parasite eggs have a protective shell that alcohol doesn't penetrate. Hand sanitizer might feel protective. It's not. Here's what the evidence actually supports. Running water plus soap plus 20-second friction. Nothing else. Let me introduce you to Marcus. He's 42, works in international development, and spent 6 weeks in rural Uganda on a water sanitation project. He was careful, drank bottled water, ate cooked food mostly, stayed in decent accommodations. 2 months after returning home, he developed persistent fatigue. Not the kind sleep fixes. He attributed it to jet lag, stress, maybe depression. For another month, he lived with this. Then his bowel movements changed. He lost 12 pounds. 3 months after returning, his wife noticed the weight loss. That prompted a different doctor visit. A thorough stool analysis revealed hookworm infection. It had been silently draining nutrients from his intestines for 5 months before diagnosis. Here's what matters. Marcus's wife and teenage son both tested positive. Neither had traveled internationally. They acquired infection at home through shared bathrooms and kitchen preparation with Marcus. Marcus wasn't careless. He washed his hands, but he didn't know about the 20-second threshold. He didn't know eggs could survive on bathroom surfaces. His wife's laundry handling created exposure. This is how transmission happens. Not through obvious filth, but through bathroom contact and household routines that people think are already safe. Now that you understand why conventional wisdom fails, here's what the evidence actually supports for reducing your infection risk by over 80%. Protocol 1, the 20-second hand wash. This is the single most important practice. After using the bathroom, wash your hands with soap and water for 20 seconds. Not sometimes, every time. Here's how to verify you're doing it correctly. Use running water, not standing water. Apply soap. Any soap works equally well. Rub vigorously, backs of hands between fingers, under fingernails, count to 20. Or hum "Happy Birthday" twice, rinse thoroughly dry with a clean towel. Do this after every bathroom use. Do it before eating. Do it before food preparation. Do it after touching potentially contaminated surfaces, door handles, railings, gym equipment, and public spaces. That single habit, performed consistently, reduces transmission risk more than anything else. Protocol 2. Surface disinfection in high-risk situations. You don't need to disinfect every surface routinely. That's impractical and unnecessary. But if someone in your household is infected, specific surfaces warrant attention. Bathroom surfaces that contact bare skin, toilet seats, handles should be disinfected with a bleach solution, 1 part bleach to 10 parts water, daily while infection is present. Door handles, light switches, and sinks should be wiped with disinfectant daily. Do this only while someone is actively infected or during a 2-week window after someone returns from high-risk travel. Protocol 3. Screening after travel. If you travel to a country where soil-transmitted parasites are endemic, which includes much of sub-Saharan Africa, Southeast Asia, South Asia, Central America, and parts of South America, get tested 4 to 6 weeks after returning. Ask your doctor specifically for stool testing for soil-transmitted helminths. Standard stool panels often don't include parasites. If testing is positive, treatment is remarkably simple and effective. The standard medications are albendazole, single 400 milligrams dose, or mebendazole, 100 milligrams twice daily for 3 days. That's it. Cost is minimal, often under $20, even without insurance. If you're infected and don't know it, you could be a transmission source for your household for months. Screening after travel is one of the most protective things you can do. If you suspect you have a parasite infection, here's what you need to know. Symptoms worth taking seriously. Persistent fatigue that sleep doesn't resolve. Unexplained anemia. Loose or irregular bowel movements lasting more than a few weeks, abdominal discomfort or cramping, unexplained weight loss. Any of these, especially if they persist beyond a week or two, warrant a conversation with your doctor specifically mentioning parasite concern. Ask your doctor explicitly for stool testing for soil-transmitted helminths, including hookworm, roundworm, and whipworm. Some doctors don't think to test for parasites in developed countries. Making your request clear ensures you get the right test. If initial testing is negative but symptoms continue, ask for repeat testing on a different day. The parasite is shed intermittently, so one negative doesn't rule out infection. Here's your concrete challenge, and I'd encourage you to start today. For the next 30 days, implement these 3 specific changes. Change 1, the 20-second hand wash. After every bathroom visit, wash with soap and water for 20 seconds. Not sometimes, every time. Track it for 30 days. Write down how many times daily you use the bathroom and check off the ones where you washed for 20 seconds. By day 30, 20-second hand washing should feel automatic. Change 2, food prep awareness. Notice where parasites could transfer during food preparation. After touching raw produce, raw meat packaging, or potentially contaminated surfaces, wash your hands for 20 seconds before touching other foods. If you or someone in your household returns from high-risk travel, increase bathroom and kitchen separation awareness for 2 weeks. Change 3, travel screening. If you've traveled internationally to high transmission areas in the past year, schedule a parasite screening with your doctor. Request stool testing for soil-transmitted helminths specifically. If you're planning international travel to high-risk regions, note that date and plan for screening 4 to 6 weeks after returning. Have you traveled internationally in the past 2 years to regions where parasites are endemic? Who shares your bathrooms? How many seconds do you currently spend washing your hands after bathroom use? Revisit these questions in 30 days. Honest answers reveal your actual risk profile. Here's what you now understand that most people don't. You're not powerless against parasitic infection. Infection isn't inevitable, but protection requires specific knowledge and specific habits, not just general hygiene, but targeted practices designed for this particular threat. You have every right to understand your actual risk, how transmission occurs, and what genuinely protects you. If you found this useful, subscribe now. This channel translates emerging infectious disease research into something genuinely protective without the sensationalism you see everywhere else. Download the free Parasite Prevention Guide linked in the description. It includes the 20-second hand wash timing breakdown, a travel screening checklist, and a symptom tracker you can use with your doctor. I'll bring you updates as new surveillance data emerges or if significant outbreaks are identified. Start your 30-day challenge today. The 20-second hand wash becomes automatic faster than you think, and it's the single most protective habit you can build. You don't need to live in fear of parasites. You need to live with informed precaution. I'll see you in the next video.